Why do you think USA residency is still the most sought after residency? What's your advice to make a good ERAS application?
What you want to put in your ERAS, it has to be kind of like meaningful toward the specialty that you're applying for. My recommendations here is try to focus on the big four.
Or how much minimum time it takes me to get matched, but is there an optimum time as well?
There are three things: margin, money, meaning. People don't have enough money to pay for the treatment they get. But in the US, there's a lot of donation and charity, especially for cancer. But how I can afford it?
So hello everyone, welcome to Delli Docs. Today's guest is Dr. Haryadi. He's an attending consultant in USA in New Hampshire. And it's absolute honor to have you on our show. I'm sure everybody listening to this podcast, watching this podcast, would be very fascinated and will have something to learn. Thank you for coming.
Well, yes, the honor is mine. Thank you so much for inviting me in your podcast.
Perfect. So I'll jump right into one of the questions that is important to me. So as an Indian medical graduate, I or every medical graduate has so many options. USA, Canada, UK, Germany, Australia, and so on. Why do you think USA residency is still the most sought after residency here or wherever in the world?
So I actually made a whole video about it, why USMLE is actually worth it compared to any other countries out there. So it comes down to three. I'm going to make it very, very short, brief. It's kind of a long video, but I'll make it very, very brief and short. There are three things: margin, money, meaning. Let's just put those three. Okay.
Wow.
Money, very clear. US physicians make good money. They make at least, I would say, $300,000 easily per year. 250,000 is what's showing at the Medscape, but that has not included the bonus. So if you are not inside, you don't know, there's an RVU bonus, there is multiple bonus, there is an extra shift that you can take. So if you want to make more than 300, it's so easy to do that in the US. You know, the opportunities are really large. So I would usually put at least $300,000 a year. So money.
But that's for the
Number
attending,
two,
not the residency, right?
that's the attending. The resident would be like $60,000 to $70,000 a year.
Yeah, but yeah, that's the same in almost every country I mentioned. I
Right,
guess.
right.
Right.
For being a resident, yes. For being the attending, it's very high. The second one is margin. Margin means like how much time you have, like what's the work-life balance. Here I'm working about 40 hours a week or less, and that includes commute, by the way. I calculate when I wake up and when I actually step my foot in my home. And that's less than 40 hours, a little bit less than 40 hours. Like I mean, my workplace is pretty close. It only takes 7 minutes.
But is
right?
this because you are an attending, or was this the same in residency as well?
If we're talking about residency, it would be different. Residency depends on the program. So some programs actually have a
Right.
higher hours, like 80 hours a week. Some programs is lower, like 50, 60 hours. So it really depends, and also depends on the specialty. But at the end of the days, you know, at the end, once you made it, once you become an attending, you know, you work about 40 hours a week. Now, if you become a hospitalist, that's still on average 40 hours because you do 1 week on, 1 week off.
Okay.
So it's pretty good. And then you can choose. There's a lot of options. Like if you become a surgeon, a cardiologist, you can choose to work the amount of hours that you do. You just find a job that that fits you, basically, because jobs are everywhere. It's not difficult to find jobs. And so that's the card margin. You have a lot of margin, you know, because the hourly rate is large. You can probably say, oh, I can make as much money in my country. You know, well, how many hours you put to get that amount of money? It's very hard to beat. The third one is meaning. Because the resources of the US is very large, so you can help all kinds of people, whether they have like leukemia, lymphoma, whether weird type of cancer or weird kind of diseases. You know, you can, because the advance of technology, there is something like CAR T cells, and on top of that, here's the issue: money, right? People don't have enough money to pay for the treatment they get. But in the US, there's a lot of donation and charity, especially for cancer. And so you can get all these. My patients got the CAR T cell therapy for free. They got paid for the hotel for free. They got surgery for a hip surgery for free. But because the US has so much resources, charity, donation, that they can help these people. And so you have meaning. It's not going to be somebody come by, oh, doctor, I have this. How can you help me? Well, this is the amount of money you have to pay. Oh, I'm sorry, doctor. I'm just going to go home. That doesn't happen in the US. You can always have an options to get the
How is
treatment that you
the
need.
waiting time for the people who don't have money? Like, is it more or is it the same as somebody who has money?
The same.
The same.
It is the same. Yeah. I would say I don't want to give a misunderstanding or misinformation here. We are talking about people who are underserved, meaning people who really doesn't have money. The problem is always the middle people. Like you maybe make 100,000 is per year. Now that's very, very difficult, because then you have enough money to not get the financial aid. It gets you out of that, but it is strangling, because it's expensive. Now that will be the issue in the middle. But if you are in a desperate moment, there's always a way to get treatment. So we don't need to get into the rabbit hole, but those are the three main things: margin, money, and meaning. Of course, I can add a little bit more. Like the work environment is really, really good. There is I don't feel any discriminations, either racial discrimination, religious discrimination. I don't feel any of that. And one of the reasons is because, in my personal opinion, medical community are basically politically leaning toward the left, which means that they very appreciate on diversity, really appreciate on the equality. So they really welcome us.
So in spite of the current political scenario, you feel welcomed everywhere.
Oh, very, very welcome. Very, 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 very welcome. I mean, New Hampshire is the state where 90% are white. I never received any form of racial or religious discriminations in New Hampshire. So, yeah.
Yes. I think the money is the biggest factor out of the three you said. I would say that in my opinion. But yeah, opinions change, people change, priorities change. So I'll quickly jump to the next question.
Yeah.
Getting to US. So my question is, the exam itself, the MLE exam, I don't think it's too difficult, because as Indians, we are really used to difficult exams. However, it is expensive, right? And I think according to an estimate, around 20,000 US dollars you have to pay to get matched once you start. So is there a way to reduce the non-fixed costs, at least? Not the exams, registrations, etc., that you have to pay, but the other costs.
Sure. First of all, I mean, I will answer that question, but I think first of all, the way we think has to be changed a little bit.
Okay.
It shouldn't be how can I save the money and reduce the costs. It should be how can I afford $25,000. Okay. So that's a completely game changer. Instead of how I reduce it, how I can afford it. Because when you start to put the questions, how can I afford? Your brain will start to find a way to get that amount of money. Right. The thing is the investment worth it? In my opinion, it's worth it, because you put $25,000 in the first year, you get $70,000 of residency, like $60,000-$70,000 per year for residency. So, and then after you become an attending, you make way, way more. So the investment is clear. There is always what we call as opportunity cost. There is a cost to pay. You have to pay $25,000, but there is also a cost of not paying $25,000.
Yeah.
Right. So I think, in my opinion, that mindset has to change a bit. Instead of how do I reduce it, but how I can afford it. That's one. Because also people don't get rich or become wealthy because they save money. People get rich and wealthy because they find a way to make more. So that is one mindset that I want to make sure that we understand here. Now, to answer your question, I still want to answer your question. Is there a way to make it cheaper? Yes, the non-fixed cost, the highest price would be when you come and travel to the US. You come travel into the US, then you will have to stay, accommodations, the travel, and the rotations itself can be expensive. So of course, the way to save the cost would be save the cost of the accommodations, and then if you're able to cook, buy the groceries, you do that. It's cheaper that way, and find some Airbnbs, rotating rooms. You have to connect with some of the groups. Sometimes there is a private groups in every country. There is a private Pakistani group or private Indian group or Nepalese group where they share, oh, I have a room over here. Oh, I have a friend over here. So that would be, I think, the best way to save and then reduce the cost. And then the rotations itself, sometimes there is a paid one, sometimes there is not paid one. Again, some concept here, very important, that we don't want to waste the money. Is the money that we pay worth it? If I pay 3,000 and then the chance of my matching will increase significantly because my experiences are great, the attendings are great, the letter will be personalized, it's come from a university hospital inpatients, that is an opportunity cost. And then you think, it's worth it. The chance of me matching after I go through the rotation is going to be very significantly high. You pay for that. The ones that I don't like and personally don't like is like you pay like 3,000, 5,000, and then you're with 10 different students. You don't get any personalized attention. You don't learn anything. You get a generic letter. You waste your money. That's the part that I don't like. The problem is a lot of companies doing that and very, very hidden. It's not really clear of what they're getting at. And so that's the issue. Now, I have rotations myself, right? In clinical rotations, I encourage my students to talk with the other people who have done rotation with me. You can see the courses that I give to you now, and I put a full refund. If you, for 30 days, I put a full refund. I mean, you go through the courses, you don't like it within 30 days, I'll give back every single cent of your money. I don't really care. If you don't feel that's worth it, I return it. I try to be as transparent as possible. Unfortunately, a lot of company is not transparent. That is the issue. So you need to know what is the opportunity that you are going to get. Now, having said that, you can also find cheaper or free rotations, and that has to be a networking through LinkedIn or emailing, cold emails. You have to have a connections, maybe from the friend of the friend, because if they consider themselves as, oh, I knew you from this, it's like helping a friend, then usually they can give it for free. Or if some university hospital provides some rotations for student or international student, and they are usually not expensive and good quality. Like Cleveland Clinic, for example, I have the whole list of that actually, and actually you can go to my YouTube or my website. There is USCE Essentials for IMG. There is a list of hospitals. I haven't updated that. I have the update, a whole update. I haven't put that in my website. I have a lot of things that I'm doing, but I plan to. After this podcast, I'm gonna put the updates and that, so people can just click that, put their name, email address, and they will email to them. Right. That is for free. They have a list, and then usually those university hospitals are pretty cheap and have a really good rotations. That would be the way to get it cheaper. The unfortunate part is it's very competitive, so you have to be very early. Connect with somebody inside, get a sponsor, network from that, and then so you have a chance to get the rotations from there. That would be the cheapest. So save the money from the rotations by accommodations, find somebody who, friends or something. And then the other one is find the cheaper rotations, but high quality through this university hospital. You apply early. Send it, have a 6 months plan ahead. That's the way to do it.
Yes. One point you said about the networking. I always say that to my residents as well. Attend as many conferences as possible. Find great leaders, great speakers. Go talk to them. So the next time you email them, probably if you have clicked a selfie, send the selfie as well. They might remember you, and it just increases your chances for a rotation. Right?
Yes. There is one thing that I want to say very quickly about networking. I addressed this in my video. I didn't really put it public. I put it within my email subscriber, but this is a very good chance for me to tell people and teach people about networking. Please, networking is two ways. It's two ways. Okay. It's not one way.
Yeah, that's
You
true.
don't do only for your benefit. Try to think what you can benefit them for. Like
Absolutely.
for me, it's very simple, right? I'm doing YouTube. I'm podcasting with you. We making a video, Dr. Haryadi, I'm interested doing rotations with you. I have this some cool idea that can help you. Can we have 5-10 minutes talk?
Yeah,
And then I
that's
can share the
very,
idea, and then
right.
it's so simple. If you're doing a research and you
Mm,
say you're in orthopedic, right, Dr. Waha?
mm,
Dr. Waha, I'm interested in your work. I'm doing the research in the same field. I have some idea and I think it can help your career as well. Would you share 5 minutes with me?
I would
Two
definitely.
ways networking. Don't keep
That's true.
can you give me? Can you give? Networking is always two ways. Like the reason why we're doing right now is because there is some benefit in you and there is
Absolutely.
some benefit with me, right? Like
Right.
for me.
Right.
So think it that way. Think what you can give for your network
Mm,
person. Uh,
that's a very
and
good
then
point.
it will
Yes.
work. So please, so when you do networking, that's the way to do it. Okay,
Right.
that's just very quick tips for me.
So that brings me to the next part of the question.
Mhm.
Uh, so we have discussed the cost, and now I want to discuss the time. So if I decide today as a medical
Yes.
graduate that okay, I want to match in a residency program in US, how much time or how much minimum time it takes me to get matched? How much maximum? Okay, maybe there's no maximum, but is there an optimum time as well to get matched?
Yes. Very quick answer here. 2 years.
2 years is the minimum
Two
time.
years. Yeah. The reason is because let's say you start in June. Actually, you need to think of when the you need to think from the time when it's not moved. The part of the time that it will not move and will not change is the time when you apply, when you submit the ERAS CV. That will
Okay.
not change, and that would be around September or September, yeah, mid to late September each year.
Okay.
So that will not change. So we use that as our landmark, and then we move back how much time we need to prepare and submit
Mhm.
that. That's the way to do it. And the answer to that is 1 year. So from the time that the ERAS is submitted, it will be 1 year from there because you
Okay. So you
submit
have to
it
do
and you got
everything
the
else.
interview,
Yeah.
right? You got the interview, etc. You
Mm.
submit the rank match order on February or March, and then you have to prepare your visa and you come and start in July or August. That is unchanged,
Mm.
fixed. Okay. So then just the question of how much time you need to prepare your CV to become competitive. And the answer to that is 1 year is the fastest because
Wow.
you need to do the USMLE,
Mm.
step 1, 2, 3, rotations, get the letter, prepare personal statement, and all those. Yeah. So that's why I said 2 years. You start now. The fastest way you get it is 2 years
And
until you
what's the
step your
ideal
foot in your residency.
and
Yeah.
what's the ideal time to start while you're in the probably the third year of MBBS or the medical school?
So I don't have a specific answer to that because I'm not familiar with each and every
Countries.
medical
Yeah.
school curriculum.
Mhm.
Yes. So, but I would say the main issue here, and this is a really good chance for me to explain because
Mm.
people, I very, very good. If you've plan to start early, and if you have decided, actually, you've decided you want to come to the US, the one of the very first step is this is after you decide to want to come to the US. The very first step is to prepare your visa. Do
Right.
the work applications and then USMLE and there's a lot of paperwork that you have to prepare so you can
Mhm.
do the exam, right? You have to start that part early. And then you have to prepare the visa early because what a lot of people do, actually they prepare for the exam, they finish the USMLE, and then, oh, I don't have visa to come to the US.
Oh, damn.
No, you already decide to come to the US. Like prepare the visa
Shit.
before. So
Right.
it's very important because it has 5 years expiration date. So once you apply, you get accepted 5 years. And in order for you to maximize your chance, and I have a quick visa guide. I haven't released it yet, but I will. The quick visa guide for non-US IMG is that if you want to come for the B1, B2 visa, which typically what we recommend, you want to maximize your chance to get those visa approved by traveling to other countries first. That's why it's
Oh,
required
okay.
preparation.
Because of your travel history.
If
Right.
you have travel history here and there, your chance of getting visa with B1B2 is
Mm.
significantly much higher. And I know
Makes
that
sense.
because I learned from the immigration lawyer, Mr. Ramsey Cullen. I make a
Okay.
lot of videos with him. So that's why the preparations comes ahead. If you think that when do I start? Well, all the preparations are going to start when you decide to come to the US, because one of the things that you need to do is to apply for the exam and to get the visa.
Right. This reminds me of year of graduation. So most
Yes.
of the graduates who apply, who get matched, have year of graduation within
Yep.
2-3 years, right? So
Yep.
what, does this matter more than 5 years? Is this a red flag for the matching programs?
The answer is actually yes and no.
Okay.
It really depends on the programs. There are some programs that prefer a fresh graduates and very strict about that. There is programs that actually okay with a high year of graduations.
Okay.
The significant issue is usually gaps. If there are gaps, that would be a red flag. And then with the technology now, depends on how you put your CV together. If there is a gap year of what you're not doing anything, the program and the software, and I know the program software, they use Telemus, and I have
Yeah.
talked to people who create that Telemus. By the way,
Wow.
I made the video. I talked with them, and they show me the inside what it looks like. So I even know what it's look like from the program director's perspective. And so I know immediately that if you don't put your CV correctly and there is a gap, they can instantly spot the gap. They create some form of, it automatically creates a timeline like lines, and you see the gaps there. So you don't want that. So that was the most important issue, the gaps. If there is no gaps, but you have a high year of graduations,
Yeah.
it really barred you for some of the programs, but it's not going to bar you completely for the other programs. The more significant determining factors, I would say, is age instead of year of graduations, and instead of and gaps. It's age. If you're like, I'm going to put an extreme number here, 60,
Wow.
right? Who will going to accept 60? And actually, it's very interesting because I have a patient a week ago, and then that patient happened to be a doctor from Egypt, and
Okay.
she doesn't work for she went for USMLE and stuff, but she didn't go for the residency and such. She did teach a step 2 CS back then, so we have a talk a little bit, and then she said that she has a friend, and then because of high year of graduations, get the interview anyway, and then this is what they said: I cannot take you. You're great, but I cannot take you because you're older than me.
Wow.
So age can be the more significant factor than the high year of graduation. I think the high year of graduation is a little bit absurd, because what if you're a genius and start your medical school at age 17? Then you will have a high year of graduations, right? But you're not old. So I don't think the high year of graduation matters. The age is actually what
But
matters.
if I look at it from the program director's perspective, so if I take fellows for under me, I really want them to be fresh postgraduates, because if somebody comes with a bigger experience than me, probably, then it's difficult to make them unlearn and relearn. They are very difficult candidates to actually teach something, because and also in the operating theater, you want the environment according to yourself. You know, you like some suggestions, some things, but it's difficult if somebody knows something entirely in a different way. You understand what I mean? So I would
I
always prefer
completely
somebody
understand.
young to
Completely
teach.
understand.
Yes.
Yes. So it's kind of like the job of that person who have a high year of graduations to show
Mhm.
that I'm willing to learn more. What I
Yes.
know is
Yes.
different than what you know, and then how they actually able to articulate that in
Perfect.
his personal statement, and
Mhm.
also during his interview, that he is willing to do that and give showing proof that he's willing to do that.
Yes.
The very first step would always be to have a chance to do that,
Yes.
and that would be to apply to the programs that is open to that. So
Find them.
yes, of course, a lot of programs would think that way, but there are programs that doesn't really use the high year of graduations as a cutoff. I strongly believe that. Yeah.
And that reminds me of ERAS application. I think it's like a
Yes.
sales pitch, right? You have to really sell yourself, condense every bit of information, your CV and everything, into a few pages and your statements. So, what's your advice to make a good application, ERAS application for matching?
Very good. So, my recommendations here is try to focus on the big four. This is very practical:
Okay.
teaching, patient care, research, leadership. So, big four.
Okay.
And you find the one that you are very, very unique and strong at, and that has to be on the top. So, because they skim, the program
Mhm.
directors and all, they just skim. If they see that you are like, I I have a student who's applying, and then he put biology mentor, and then in the description he said that he has a Facebook group of 50,000 people, writing 3 or 4 books, have a YouTube channel, being the best biology teacher in his university, a private university, for the straight either 4 or 5 years. You are not biology mentor. You're biology professor.
Yeah.
So you see how just put the correct highlight there. So that's, I think, one way to make it stand out. You need to put it the correctly on how you sell it correctly out of those four, and then put it on the top so they see, oh, you are a research fellow. Oh, you are a biology or something professor. So, oh,
Mm.
you are very qualified in one of those four, right? And then the rest are keeping it as all-rounder as possible. You don't want to just do good
Yes,
one
limit
thing. Of
yourself.
course, you put your hobbies, you put what the things that you
Mm.
do. If you are a champion in badminton, you put that. If you are organize some form of events, a big event, maybe you do a leadership NGO, you want to put that. So you want to be an all-rounder in the CV, because you try to kind of like capture as many people as possible, but at the same time, you want to be laser focused on certain things on the program on internal medicine. For example, if you want to be in neurology, well, don't put an orthopedics research inside your CV. You know what I mean? Okay,
Right,
so if you
right.
really want to do neurology, then everything has to be at least related or make sense to what the neurology. If you want to become a surgeon, like an orthopedic surgeon, maybe your hobby shouldn't be table tennis. Maybe your hobby, maybe you have become a champion on building some Legos or some sort. You see what I mean?
Yeah.
So it's at least it's related to what you're going to do. So that is
Mm.
being mindful on what you want to put in your eras. It has to be kind of like meaningful toward the specialty that you're applying for.
Right.
Yeah.
It makes sense. And one
Yeah.
anecdote I remember, I don't know if it applies to this USA program. When I was a resident, one guy came to my professor and talked to him out of the blue. He was an MBBS student. MBBS is the name of the medical school here. So he was a medical school graduate, and he talked to him for a while, which is very rare. Professor didn't reply or anything, but in the rounds that evening, he remembered that, okay, this guy came, Naman, and I'm really impressed. He had the guts to skip everything, come directly to me and talk to me about it. And that guy eventually ended up as a fellow. So I think, I don't know how much it matters here, but sometimes you have to be gutsy and reach them directly. I don't know.
Yes. It
Yeah.
really depends on your
And
personality and such. Yeah.
so the next question is about the personal statement, your story,
Yes.
how to
Yeah.
make it perfect. It's about story, right? How do you sell your story?
So I actually create the whole webinar about this in the irresistible personal statement
Okay.
webinar. I explain it very, very, I think very thoroughly. There is some practical things. There are foundational concepts. So you can watch that. Obviously, is for free. But I'm gonna share very quickly the one of the main thing, which is novelty.
Novelty. Okay.
Novelty, meaning that you have the courage to be different and sounds different because they read so many personal statements every year, and then everything seems and sounds and feel and taste the same. In order for you to stand out, you need to feel and sound and taste and see it's like different. And in order to be, that's the key, you want it to be very, very different. If people are always talking about, I remember that patient when I was, guess how many people do that? Okay.
Yeah.
But once you start your story with something that is very, very different and unique, I remember when I played Tekken. If you, I think Sartek knows about it, but I play competitive fighting games before, and I got third place in the world in 2012 Paris Esport World Championship.
Oh, wow.
If I start myself as an anecdote of, I've been losing all my entire life when I play this game. I start this game when I was, I think, the same age as my daughter, about 8 years old, and I was able to beat my 6-year-old brother, and I become very, very interested in playing competitively, but doing competition, I always lose. And I was wondering, how can I win this? And then I describe the story on how I win this, and I translate that, how that resilience, that focus, that mental capacity, agility, translate into how I can become a great internal medicine doctor. Now that's suddenly a different story. You own that. It's not about that patients, that this patient and that patient, you see. So one of the easiest way actually to make a personal statement is unique and different and stand out is use the non-medicine ones. Actually, that's one of the simple, super practical ways to do it. You start with that, and then suddenly it becomes different. You're suddenly talking about you and not talking about that patient. So that's one way to stand out. But there are a couple things, concept that I shared in that webinar. And I must say that I think I should say it here. Sartak's personal statement is one of the best that I've ever read among any of other of my students. It is one of the best one. It's so personal. It's so refreshing. It's so exciting. I really, 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 really love that personal statement. I think he takes everything that I mentioned.
What he wrote.
He takes everything that I mentioned and taught him like really, really properly. So refreshing, so great. People would be very interested to see him as a person. So I just give it out there,
Maybe once he matches, we'll share it online. Yeah.
Oh, sure. Yes.
So that's great. One question I missed actually in this ERAS application and CV. There is one thing called publications, abstracts, paper presentation. I think it is in trend. It's a hot topic, but it's more of a fear. A lot of students message me, they are afraid because it's not easy to get them. So many people already have them. So please, I need your take on publications.
So here is the thing. In ERAS and then in the NRMP survey, the poster, abstract, research, publications, that the one that actually published, meaning by peer-reviewed, are come together. So when they put in the NRMP some survey of, they have 10. Those 10 are not 10 publications or peer-reviewed publications. Those 10 are not an NAGM articles that they publish.
Yeah.
Those 10 are combinations of case reports, combinations of poster presentations, and all those. Okay. So you don't have to be, wow, 5, 10. I need to publish 10. No, it's combinations of all of those. So I hope that kind of reduced the expectations a little bit. So you can still do some basic case reports and all those that actually counts. Okay. And then the next thing is depends on the program. If it's tertiary program, it's University of Pennsylvania, University of whatever, like Stony Brook University, then they would want more publications. They would want more or those presentations, abstract, etc. If you go to community program, if you get about 5, this is already very, very competitive from that standpoint. Actually. So you can only get like 2 or 3, but not 0. No, not 0. 0 sounds like a red flag. Like are you really interested to do anything at all? So not 0, something 2 or 3 case reports. It's fine. Systematic meta-analysis articles, fine. But you have to have some form of scholarly activity to make you looks like an all-rounder, and you will
Right.
still get the chance to get the invitations. Yeah. So it really depends on which, and then I would recommend to look at, because we are in a signaling era right now. So you signal the program that you're interested with. So what you want to do is to research if how many publications that those residents have that work inside the program, right? So if the residents is usually, oh, I have 3, I have 4, oh, it was just 2 case report, oh, it was just 1 meta-analysis, right? So that means, okay, that means I'm qualified in the eyes of that program. And so you can apply there. If that program is like, I have 10, then okay, you stay away. Don't give any signals. You're not qualified.
Okay,
So that's the
that's
way
interesting.
to navigate that. Yes.
Perfect. So before we complete this session,
Yeah.
it's a personal question I want to ask. Can you
Sure.
describe your day, a day in your life as a resident versus today as an attending? I think that would be interesting. Yeah.
Okay, that is a very good question. I just want to say that out there that every program is different. So people will have completely different experience than me.
Absolutely.
Okay. And then the location of the job that I do is also different, and people will have completely different experience.
Right.
Okay. So don't use me as your landmark, or because it's dangerous
Was it
to do
that
that.
good
But
for
I'm
you?
gonna give you, because it's that good for me. Yeah. So yes, it is that good for me. So I just want to let it out there, and then so people would know. But this is going to be personal, answers to specifically for me. So during my residency, I start the day around 7. At 7, not around 7. I have to be there at 7 for morning report, for 1 hour morning report. That morning, by the way, a lot of people probably confused with the morning report means there is something the night before that they have to report in the morning. That has nothing to do with that, okay? Morning report is just an exercise where we talk about cases. Sometimes it's neurology morning report,
Got
meaning
it.
it's neurology topic.
Yeah,
It's
yeah.
a learning in the morning. That's called morning report.
Right.
I don't know why they call it morning report, but it's just a learning about cases in the morning. Okay, it could be any topic. So that's on 7 to 8. And then from 8 to 12, we go, this is going to be a typical floor day. So I go to the floor, and then I review the cases, right? And then review the chart, see the patients, and then I discuss with my resident on what we're gonna do for that patient today, do what labs, maybe continue antibiotic, call consults, etc. Once we got our plan, we usually call our attending. It's a community hospital. We don't do those round thing. We call our attending and report them, and then what's going to be the plan today. They give us instructions on what to do for that patient. We put the order in and then take care of that. And then at noon, we'll have a noon conference from 12 to 1. And then after that, at 1 to 3:30, we finish everything that we need to do. Maybe there is a new admit, but we take turns for the new admits. Maybe something that we need to follow up, maybe a BMP follow-up, and then what we need to do about it, call the attending the second time for the plan for the next, and all those. And we end at 3:30. From 3:30, we'll be taken by the short call. We sign out to the short call team. They will stay in the hospital from 3:30 to 7, and then they sign out to the night float team, and the night float team will take the rest. So that would be the typical day in the floor.
7. From 7.
If you're doing short call,
okay.
If you only do short call like once a week, so the rest you go home at 3:30 and you're done.
And does it change over the years? For example, in India, first year resident works almost 24/7, and then the final year resident works very, very less. He has more of a managing inside the theater, operation theater kind of role. It changes.
It doesn't change. It's only changed the role. So when you're second year, you're supervising the 2 interns, and then you have more patients. You have 16 max patients.
So it becomes heavier with seniority, or it becomes lighter with seniority, the work?
In general, it becomes lighter in terms of the scout work. Like you don't actually keep writing the notes, you don't keep calling the attending and then putting the order. So that part of the work is less. the duty, the responsibility is obviously higher. You make
Makes
more
sense.
micro decisions, especially in my hospital. We have a lot of autonomy to make decisions. Let's do this BMP on this time. Let's do this. Let's do this. So residents have that ability to do that. Like when I was in ICU, and ICU have completely different schedule. By the way, it's not that kind of schedule that I mentioned. So we don't need to get into that. But during the ICU rotation, we have nights, and then during the night, I manage the DKA patients myself. I decide on the fluids, like the insulin, stop it, give potassium first, stop that, change that, and all those. So I manage everything by myself. I don't even really call the attending, or because we don't have endocrinology or overnight. So and we can handle it ourselves, and I do that. Well, that's one of that cases that I don't actually like, because I won't be able to sleep. Because we have to change the fluid every 3 hours and monitoring the sugar and then the electrolytes. So I have the K patients. I have to wake up all night now. So yeah, we manage ourselves. So more responsibility on the PGY2. So that is during the residency. As an attending right now, I'm doing an outpatient. And I do hospitalist per diem, so sometimes I take shifts. But let's talk about the main job first, which is the outpatients. So a lot of people choose 4 days work and 1 day admin day. So that's the difference. I don't. I do 5 days short days, so I don't have any admin day. Admin day is where you do your in-basket, answering people's message and labs and sometimes call patients and all those, and FMLA paperwork for work. People wants to leave work, people need disability and all those. That's called admin day. I don't have that day. I separate it between all those 5 days, but it becomes short days. So I wake up, lately I go to the gym and exercise, so I wake up early, and then I do this helping non-US IMG and make video and all those. So I wake up in the morning, but just for the work, okay? So if it's just for the work, I can wake up at 7:45 and then prepare 5 minutes. I'm a guy, I don't do makeups. So we go, and I go, it only takes 5-7 minutes to go there. And I start my day at 8, my last patient at 2. I usually finish at 2:30, and I have an extra half an hour to finish all the message that I mentioned. So I'm not doing a specific day or committing with a specific day to do the admin. I have that and in between patients for me to do all those things. So I'm done at 3. I got home 3:15. I'm done with my day from Monday to Friday.
So 7:45 to 3:15, you're done. That's crazy.
Yes.
That's crazy.
Yes. That's a typical day. Of course, again, I mentioned that I have an hospitalist shifts per diem. So sometimes I take shifts on the weekend, on Saturday, Sunday, between 4 to 10 or 4 to 11. That is not every weekend. And it's up to me whether I want to take the shift or I don't want to take the shifts.
But that's a great schedule. But for me, if I compare my work, it's too heavy. I sometimes wake up at 5:30 to do a case at 7, and then on some days a week I might reach home at 9 p.m. So yeah, but that's the life of a orthopedic attending, I guess.
Of course. Yes. I mean, I don't know what's the life like for orthopedic attending in the US. I don't know. Maybe that will be something I can explore in the future.
Who say similar things from US as well. Yes.
I think it depends on how much work you want to do and how
especially
much
the trauma guys. They are working more, I think, even more than what I said.
Wow.
Yeah.
Wow, in the trauma. Yeah, maybe it's a busy trauma center, but again, you have a lot of choice on what you actually want to do. So
they can choose to not work that much. But I guess they are just workaholics,
Yeah, maybe. yeah. So, but that's basically my schedule. And then again, with that schedule, I make more than 300,000.
Wow,
that's easily.
Cool. That's really
so. That's the thing.
I'm sure a lot of people would be inspired by that. Yeah.
the money. Yeah, but don't forget money, margin, and meaning for me.
So it was really a pleasure talking to you. So many learning points for everyone. In fact, was actually so fascinated. Although I'm not planning to give USMLE anytime, but yes, it's really
Yes.
fascinating to talk to you. Thank
Sure,
you so much.
pleasure is mine. Yeah, yeah. Happy to, anytime if you want to invite me for any other topics, I'm
Yes,
open to it.
let's see.
Yes.
Let's see what the comments are. Maybe we can do a follow up. I actually got interested in the publications part. I can maybe we can do some follow up on that if the
Okay.
people want it. Yeah.
Yes, yes,
Yes,
yes, yes.
yes,
We
yes.
can discuss what's the next topic that makes sense. So,
Perfect. Great.
okay.